Today, I'm going to bring a topic that is pretty popular for people in the world dealing with back pain. Now, this just does not pertain only to North America, United States and Canada, but worldwide. I have lots of clients in Europe and Asia, and they deal with the same deal. And what I call it is the medical industrial complex. In this video, I'm going to tell you why your general practitioner or your doctor is not likely to help you with your back pain. My name is Brian Carroll. I'm a McGill certified practitioner living in Jacksonville, Florida. I've also been a certified massage therapist since 2003. What I'm giving you today is not medical advice. However, what I am giving you is real world validity with things that I've experienced. I've learned from Dr. McGill as we wrote together a Gift of Injury, as we went from daily pain to being the first person to squat over 1,300 pounds. My goal is to show you that I've tried these different things. I have experience with them. I've failed with them. Now, you might ask, well, doctors are supposed to be medical professionals. They should know all things about the body, which is true, but not all doctors are created equal. Now, what happens in most cases is you go to see the doctor, you have a sore back. They'll say, okay, here's a prescription potentially. Now, maybe go get an MRI. But generally what they'll do is they'll refer you over to physical therapy. Or they end up telling you, do some yoga, do some stretching. Well, what does that even mean? Here's the problem. Doctors do not have a billing code for counseling or consulting to be able to understand where you've been, where you are, where you want to go, what actually causes your pain. And you're lucky if they spend 15 or 20 minutes with you talking to you about your back. So one of the problems with the time limit and the billing aspect is you are really just a number. These doctors make their rounds and they might have 50 or 100 people that they see that day from room to room to room, and they can't sit down with you. And the way the insurance works is they try to maximize with each visit and then they escalate you. The problem is when they tell you just to do some generic stretching or some yoga or chiropractic, what does that even mean? Each injury mechanism and each particular injury, the genetic predisposition, there's a lot of different factors there. Back pain absolutely is multifactorial. Depending on what kind of injury you have, stretching might be appropriate, chiropractic might be appropriate, but in a lot of cases, it's not gonna be. Here's the disconnect. When you go and you see a doctor and they refer you out to physical therapy, your chances of getting better with the physical therapist are 50-50 at best, depending on who you have. There's a huge disconnect in the medical industrial complex. You go to the doctor who never talks to your physical therapist, they refer you over to physical therapy, and that fails. They give you 6 weeks or whatever, you're not better. You go back to the doctor, they bill insurance again, then they refer you out to pain management or maybe an MRI. It depends on who you go to. So let's say you get an MRI. The radiologist that interprets your MRI never meets you. They never ask you questions. They don't understand your history. If you're a powerlifter or a golf player or whatever it is, a UFC fighter, they're just looking at an image without any context of who you are, where you've been, and where you're going. The problem lies, they look at about 35 or 40 images at a time, or a day, I should say. They either see something or they don't, then they move on. After this report is done, they send it back to your primary care physician, or maybe your surgeon. There's no communication, there's no meeting of the minds with these practitioners. So sometimes you have involved a pain management doctor that wants to do shots, may refer you to get surgery potentially, who never talks to your doctor, who never talks to your physical therapist. There's no cohesive aspect to getting better when it comes to the back. Everyone's just kind of playing on their own field and not communicating and coming together. That's where I come in and help consult and give my thoughts on why someone's not getting better, what kind of physical therapy will be appropriate by doing an assessment and understanding the causes of pain, the loads and postures and movements that exacerbate pain, and then wind them down. Brian Carroll here, PowerXStrength.com owner. I want to tell you really quick about our CBD line. Our CBD is 100% CBD isolate derived from hemp. And this is within the parameters that go into effect, a new law in October of 2024 All of your full and broad spectrum CBDs are now illegal. Your Delta 8s are now illegal. The PRS CBD collection is made up of 100% CBD isolate in drops, 3 different flavors. We have balms in 4 different scents. We have gummies in 5 different flavors. And most recently added to our roll-on collection to go along with CryoFreeze is Heat Wave. 1,000 milligrams of CBD isolate with a heating, soothing formula that's gonna help you rub away muscle soreness and pain. Use code YT1306 at checkout to save 20% off your CBD order. I went and met with someone the other day who has a failed back surgery, and I lost my mind when I heard what he told me. He has a failed laminectomy. He didn't follow the principles and protocols that I suggested to him post-surgery. And he said, hey, the neurosurgeon spent a lot of time with me the other day, and I was pretty happy with it. I said, really? How long did he spend with you before saying that you needed to have another laminectomy and microdiscectomy? He said 15 minutes. 15 minutes to make the decision that's gonna affect him the rest of his life. You can't tell me with a straight face that this is good enough, this is sufficient, and this is good medical practice. Now, once again, I'm just a dumb personal trainer that's McGill certified and has worked in this field for the last 11 years, and I've been through the medical industrial complex where I went to the doctor and they just said, hey, do some stretching. Then they sent me to physical therapy, cookie cutter handout, stretch, go to the chiropractor. None of these people talk. And then eventually the pain management where they're doing shots. Next thing you know, I'm meeting with neurosurgeons and orthopedics that are saying, hey, we looked at your MRI with no assessment. No assessment was given to me, and most likely you're out there, no assessment has been given to you, and all this information has not been gathered to give you the best treatment. You're not alone out there. This happens to a lot of people. The medical system is not set up with your best interests in mind. Seek out the best professionals in your field. If you don't feel like you're getting time to be able to tell your story to your doctor, to your pain management doctor, to your surgeon, to your physical therapist, to your chiropractor, and you can't get all those people to communicate and get on the same page, find yourself another system and do not proceed ahead because you might regret this for the rest of your life. See Back Mechanic for more details about whether you're a surgical candidate or not. Surgery should absolutely be your last step, but some people are gonna need a surgery. Some people with serious falls and they have unstable spondies maybe, or they get crushed in a car accident. These people might not be able to avoid surgery, but chances are this is not you. You're a cumulative injury that's been happening over time, and you failed with physical therapy. Maybe you've gotten a little better at times here or there. Maybe chiropractic has helped you a little bit, but until you get everyone and everything on the same page, your chances of falling through the cracks like so many people in North America and throughout the world, that likelihood of that happening to you is very significant. And trust me, I have empathy for the back pain person because I lived it, and you'll read about in Gift of Injury, I was on the brink of doing some serious things. Thank you so much for watching today. If you like what I'm doing, please like this video, subscribe to my channel, Brian Carroll 1306, share this video, and tell someone about this video that you watched today, and have a great day.